Yes, it's Craig Gussin. He joins us occasionally to talk about what's happening as we go along this process. Craig, good morning to you.
Good morning, Dan.
All right, we were just looking and we're going down a whole list of bullet points of things that are issues here, starting with the fact that under the House plan, it creates over 100 new agencies, including a new health czar.
Yep.
That is a lot of bureaucracy.
It is, and the first thing I think of is, okay, it's one way to get rid of unemployment because we're going to be hiring all these people to work for all these agencies.
Well, government is the growth area these days when you're looking for jobs.
It seems like it is.
It is.
But the concern is that's going to end up costing more money, which means someone's going to pay for it, and at the end of the day, we all know it's the consumer who's buying health insurance is going to end up paying more money for it, and that's a concern I have.
Yeah, because obviously you have to pay for the agencies that are shuffling these paperwork around and all this kind of thing. So cut down on the agencies. I mean, it just seems ridiculous.
They can pretty much, they don't need the agencies. What they need to do is put the money where it's really going to work. Put it to cover the kids who are uninsured under S-chip or healthy families in California. That's, you know, that's what, 18 million kids that we could cover right away. The insurance industry, every broker I know wants the same thing. We want everybody in the United States to be able to get health insurance. As you and I were talking before, in California, we pretty much have it locked in. We have the 6th lowest rates in the country. You know, of all the countries in the world, California we consider the 8th largest. We've done it right.
Quite an economy, yeah.
Yeah, we've done it right. What we need to do is we need to say, okay, if we're going to guarantee everybody health insurance, then what we need to do is to get everybody to have skin in the game and get health insurance. And how do we force people to buy health insurance?
That's a good question. And right now, under the Pelosi bill, there could be a fine of up to $250,000 and 5 years in jail for not buying health insurance as mandated by the federal government, as ordered by. So how do you enforce that? And you and I were talking and saying that there's actually talk that if you get pulled over by a police officer, they would ask you if you had health insurance, and you could get a ticket for not having health insurance.
They've talked about that. They've talked about when you send in your tax return that you have to prove that you have health insurance. But it's a lot of the same thing where 75% of people have car insurance, so what do? If they have to renew their license, you know, the registration,
show your insurance.
They go and they buy insurance for a month, they get their license, and then they cancel it. It's the same thing. You can't force people to buy health insurance if they don't want to. What they're going to do is they're going to wait till the day they get sick, and then they're going to call up and say, I want health insurance. Well, one of the things that the industry has proposed is if you go more than a couple months without health insurance, it won't cover pre-existing conditions for up to like 3 to 6 months. Yeah. So at least it forces you that you can't just wait and get it at the last minute. Yeah.
So now, if this goes through in some form and people are forced to buy the health insurance, obviously you're talking about very young age, maybe from 18 all the way to the very older folks, and you say there really needs to be a balance of, you need to get a lot of young people on there.
Right.
So you guys can make some money without shelling it all out.
You know, the young people don't use it. 80% of all of your medical expenses will be incurred in the last 3 to 5 years of your life.
Wow.
So if you think about that, and right now they're talking about that they're going to get rid of Medicare Advantage, which are HMO, PPO plans, that either are no cost to the seniors or very low cost. And that's 10 million seniors that we have to lose that plan. Yeah. That's one of the reasons why IRP is so in favor of the health care reform, because they don't make much money. You know, IRP is a marketing organization. They don't make a lot of money from the medical advantage plans, but they do from the other plans. So that's why the Medicare Advantage plan is something that I'm a big believer in. I have my own mother-in-law in a Medicare Advantage because it's a great benefit, low cost, it gives her everything she wants. By the way, the House bill, the exchange that they're going to have with the government plan will only offer 4 individual plans that you can pick from. So if you have an individual plan today, Dan, and you want to make any changes to it under the government plan or the House plan, you're going to have to buy one of the government plans. You're only going to have 4 options. Today, there are 129 different options that you can buy for individual health insurance.
Well, we shall see. It's headed over to the Senate. I have a feeling it's going to be a different story over there.
The Senate's going to be a totally different animal. What they're going to do is the Senate will not pass a public option. They don't have the votes. They never will have the votes.
No.
Lieberman said no. A couple other Democrats have said no. So the public option will be gone completely when the House and the Senate bill, if it does get together. They're saying right now the Senate bill may never come out purely because they can't agree on anything.
All right. Craig Gussin with the Insurance Institution, thank you so much this morning. We appreciate your insight.
My pleasure.
And of course, we'll be talking to you as this goes along. Of course, it was supposed to be wrapped up in August, wasn't it?
Yes, and now they're talking possibly February, March. Later it goes into 2010. The worst case we have of getting something done. Because
so we get closer to those midterm elections. Everybody's voting their district. Thank you so much, Craig.
My pleasure.
See you later.